Deep plane facelift. What is it? How do I do it? What's the artistry behind it? What's the recovery like? And then what should be your expectations in terms of aesthetic results? First of all, what is the deep plane facelift? It's a technique where a surgeon is lifting and shaping the muscle and the fascia layer. To understand what these layers mean, we really have to understand that facial anatomy is kind of like layers of an onion. And if you peel away the layers, going from superficial to deeper layers, then we're getting to layers that we're actually shaping and sculpting. So the outer layer is the skin layer, of course, skin fat layer. That's not the layer that we want to pull on. And although we often do this to try to simulate facelift results, it's the deeper muscle fascia layer, the muscles that control the facial movement, that actually we're lifting in a deep plane facelift. So deep refers to below the surface of skin, plane is just layer. So that's a technique, deep plane facelift, where we're lifting the muscle fascia layer. And by doing that, we can get more reliable, natural looking results where patients don't look windswept or have their mouths pulled or ears pulled down, such as can happen with skin only lifting. There's still surgeons who do skin only lifts, but that's not a good idea. Deep plane facelifting is really the most modern technique. And the reason it's very meticulous is because there are a lot of nerves that control facial movements that we have to understand the anatomy and protect those nerves and do this in a very safe way. So that's basically what a deep plane facelift is. How do I do it? Well, first of all, you're under anesthesia, you're asleep. It's a very light sleep. And although there are many little details that take several hours to complete a deep plane facelift, it's safe for healthy people who don't have heart, lung, kidney problems to be under anesthesia for approximately 4 hours or so to do a full deep plane facelift, neck lift, and oftentimes I'm also addressing deeper structures of the neck. So in terms of the deeper structures, let's talk about the neck lifting, because that goes hand in hand with facelift and neck lifting. I have to make an incision here under the chin to get access to under the jawbone. Oftentimes with facial aging, we're seeing changes in the face, but also we're seeing heaviness in the neck. And that's because, in particular, the glands that are underneath the jawbone tend to start to drop and fall, and it creates fullness. So through that incision, I get access to the deep layer, the deep plane, meaning the neck muscle, called the platysma muscle. That is the deep plane of the neck. Lift up the platysma muscle, get access to those little glands that you can feel just by rolling your thumb and finger here. Reduce those glands, then tighten up the platysma muscle. That's the deep plane of the neck. I continue that lift of the deep plane, meaning the muscle fascia layer of the face. That nicely smooths the nasolabial folds, addresses corners of the mouth, down turn, marionette folds as well. And we get this much more natural, rejuvenated appearance. And of course, because the muscle fascia layer is the strength layer, meaning that really holds the lift, then we get many years of longevity of the results. As compared to skin-only tightening, not a good idea, not only because we get distortion of the mouth and of the ears, and we see this windswept look, but also the results don't last. So that's why skin-only lifting, or superficial plane lifting, is not a good idea. So the artistry really is understanding the anatomy, but lifting in the direction and the shaping of the face and the neck in a way that just really rewinds the clock. And oftentimes we can get results where patients look 20 years younger, maybe even 25, 30 years younger, depending on what our starting point is. And I always ask patients for historical photos from prior decades so I can see how their faces change with aging, really critical. Now, in terms of recovery, oftentimes people need to know, when am I going to look normal to other people? Typically that transition happens about 3 to 4 weeks after surgery. Everybody's a little bit different. Some people take a little longer. It also depends on what you do for a living, or if you need to be inclined interactions face-to-face with people, it might take a little longer to have the bruising and swelling go down to the point where you look relatively normal. If you're on high-def television, for example, I take care of Congress people and news anchor people, and they need a little longer time to look totally optimized. So they may need about 5 or 6 weeks. So the range is from 3 to 6 weeks of recovery to look normal again. Now, this is not a terrible recovery. It's not terribly painful. Actually, pain is pretty minimal. It's just kind of waiting out that swelling to resolve. Safety, top priority, always safety, safety, safety. A close second place is getting the results, beautiful, natural, refreshed. And in terms of safety, Of course, consulting with board-certified plastic surgeon who focuses on facelifts and also doing the surgery in the most controlled environment with board-certified anesthesia teams. So in the hospital-based surgery center environment, that's where we get maximal safety, not in my office. Okay, deep plane facelift in a nutshell.